If you're an older man and you masturbate, I need to ask you something. Have you ever wondered if it's truly healthy after the age of 50 or 60? I'm a board-certified physician specializing in men's health and aging. Today, we're going to have an important, medically informed discussion about a topic that affects millions of mature men worldwide, yet remains largely unaddressed in mainstream healthcare. If you're a man over 50, or if you care about someone who is, this video contains information that could significantly impact long-term health outcomes. What we're discussing today isn't just about comfort or preference. It's about genuine medical science and evidence-based health practices. Throughout my years of clinical practice, I've encountered countless men who harbor serious concerns about changes in their intimate health as they age. These concerns are valid, they're common, and most importantly, they deserve honest, professional answers based on current medical research. Today, I'll be addressing the complete medical picture surrounding male intimate health practices after age 50. We'll examine both the documented health benefits and the potential medical risks, all through the lens of peer-reviewed research and clinical evidence. This isn't about moral judgments or personal opinions. This is about your health, your well-being, and ensuring you have accurate medical information to make informed decisions about your body. As men age, particularly after 50, several significant physiological changes occur that directly impact intimate and sexual health. Testosterone levels naturally decline at approximately 1 to 2% per year after age 30, accelerating after 50. This hormonal shift affects everything from libido to cardiovascular health to cognitive function. Simultaneously, blood flow patterns change due to age-related vascular changes. The endothelial function, that's the inner lining of blood vessels, becomes less efficient. This affects circulation throughout the body, but particularly in areas with smaller blood vessels, including intimate anatomical structures. Prostate health becomes increasingly important with age. By age 50, approximately 50% of men will experience some degree of benign prostatic hyperplasia, prostate enlargement. By age 80, this number rises to nearly 90%. Understanding how intimate health practices affect prostate function is crucial for long-term wellness. Additionally, the pelvic floor muscles, which play a critical role in urinary control, sexual function, and core stability, naturally weaken with age. This process can be accelerated by sedentary lifestyles, but it can also be positively influenced by appropriate physical activity. From a neurological perspective, the pathways that control sexual response and arousal can become less efficient with age. However, research suggests that regular stimulation can help maintain these neural pathways, much like how physical exercise maintains muscle function. These physiological realities mean that intimate health practices aren't just personal choices for mature men. They're medical considerations with real health implications. Let me walk you through what current medical research tells us about the health benefits of regular intimate activity for men over 50. Cardiovascular health protection. Multiple large-scale studies have demonstrated that regular intimate activity provides significant cardiovascular benefits. A landmark study published in the American Journal of Cardiology followed over 1,000 men for 20 years and found that those who engaged in regular intimate activity had a 45% lower risk of developing cardiovascular disease. The mechanism is straightforward. Intimate activity increases heart rate to approximately 120 to 150 beats per minute, equivalent to moderate physical exercise. This provides cardiovascular conditioning, improves endothelial function, and helps maintain healthy blood pressure levels. For men over 50 who may not engage in regular cardiovascular exercise, this can be particularly beneficial. The activity promotes vasodilation, the widening of blood vessels, which improves overall circulation and can help prevent the development of atherosclerosis. Hormonal regulation and balance. Regular intimate activity helps maintain optimal hormone levels in several important ways. First, it supports healthy testosterone production. While testosterone naturally declines with age, research shows that men who maintain regular intimate activity tend to have higher baseline testosterone levels compared to those who don't. The activity also regulates cortisol, our primary stress hormone. Elevated cortisol levels, common in older adults due to life stressors, can suppress testosterone production and contribute to various health problems, including diabetes, hypertension, and cognitive decline. During and after intimate activity, the body releases oxytocin, often called the bonding hormone. Oxytocin has numerous health benefits, including lowering blood pressure, reducing inflammation, and promoting cellular repair processes. Prostate health and cancer. Prevention. This is perhaps one of the most significant medical benefits for mature men. Multiple studies, including a major Harvard School of Public Health study involving over 29,000 men, have consistently shown that higher frequency of ejaculation is associated with a significantly reduced risk of prostate cancer. The protective effect is substantial. Men who ejaculate 21 or more times per month have a 33% lower risk of developing prostate cancer compared to those who ejaculate 4 to 7 times per month. This protection appears to increase with age, making it particularly relevant for men over 50. The proposed mechanism involves the regular clearing of potentially carcinogenic substances from the prostate ducts. Think of it as a natural cleansing process that helps maintain prostate health. Pelvic floor strength and urinary health. The rhythmic contractions that occur during climax provide excellent exercise for the pelvic floor muscles, including the pubococcygeus muscle, the bulbocavernosus muscle, and the ischiocavernosus muscle. Strong pelvic floor muscles are crucial for several functions that become increasingly important with age: urinary continence, bowel control, and erectile function. Many men over 50 begin experiencing urinary urgency or mild incontinence. Maintaining pelvic floor strength through regular activity can help prevent or minimize these issues. Neurological and cognitive benefits. Recent neuroscience research has revealed fascinating connections between intimate activity and brain health. During climax, the brain releases a complex cocktail of neurochemicals, including dopamine, norepinephrine, and endorphins. This neurochemical release has several important effects for aging men. It enhances mood, reduces anxiety and depression symptoms, and may actually help maintain cognitive function. Some studies suggest that regular intimate activity may help preserve memory and executive function as we age. The dopamine release is particularly important because dopamine levels naturally decline with age, contributing to decreased motivation and pleasure-seeking behavior. Regular natural dopamine stimulation can help maintain mental vitality, sleep quality, and recovery. The hormonal cascade following intimate activity creates an ideal neurochemical environment for deep restorative sleep. The combination of oxytocin release, cortisol reduction, and endorphin production naturally promotes relaxation and sleep onset. For men over 50, who often struggle with sleep disorders, including sleep apnea, restless leg syndrome, or general insomnia, this natural sleep aid can be particularly valuable. Quality sleep is crucial for immune function, tissue repair, and overall health maintenance. Immune system enhancement research published in Psychological Reports found that individuals who engaged in regular intimate activity had 30% higher levels of immunoglobulin A, an antibody that plays a crucial role in immune function. For older adults, who naturally experience some decline in immune function, a process called immunosenescence, this boost can be significant. A stronger immune system means better resistance to infections, faster recovery from illness, and potentially reduced risk of autoimmune disorders. Pain management and inflammation reduction. The endorphins released during intimate activity are natural painkillers. In fact, they're more potent than morphine when measured gram for gram. For men dealing with chronic pain conditions common in older adults, arthritis, back pain, neuropathy, this natural pain relief can be substantial. Additionally, the activity promotes the release of anti-inflammatory compounds that can help reduce chronic inflammation, a key contributor to many age-related diseases, including heart disease, diabetes, and Alzheimer's disease. Cardiovascular overexertion. Risks. For men with existing cardiovascular conditions, sudden intense physical activity, including intimate activity, can potentially trigger cardiac events. This is particularly concerning for men with undiagnosed heart disease, which is common in older adults. If you have a history of heart attack, stroke, uncontrolled hypertension, or take cardiac medications, you should consult with your cardiologist before engaging in any intense physical activity. The general medical recommendation is that if you can climb 2 flights of stairs without chest pain or severe shortness of breath, intimate activity is likely safe, but professional medical evaluation is always preferable. Tissue trauma and injury prevention. With aging comes increased skin fragility and decreased natural lubrication. Aggressive or prolonged activity without proper preparation can result in tissue trauma, microscopic tears, or abrasions. These injuries aren't just uncomfortable. They can become entry points for bacterial infections, which can be particularly serious in older adults who may have compromised immune systems or diabetes. The medical recommendation is always to use appropriate lubrication, maintain gentle technique, and stop immediately if any pain or discomfort occurs. Quality water-based lubricants are preferred as they're less likely to cause irritation. Postural and musculoskeletal. Complications. Many men engage in intimate activity while in compromised positions, hunched over, sitting in uncomfortable chairs, or lying in positions that compress nerve pathways. The pudendal nerve, which runs through the pelvis, can become compressed with certain positions, leading to numbness, tingling, or pain in the genital area. This condition, called pudendal neuralgia, can become chronic if not addressed. Always ensure you're in a comfortable, supported position. Lying down with proper support is generally the safest option from a musculoskeletal perspective. Psychological dependency and isolation risks. From a psychological perspective, when any activity becomes the primary or sole method of managing stress, anxiety, or loneliness, it can become problematic. This is particularly concerning for older men who may be dealing with retirement transitions, loss of spouse or friends, or social isolation. Healthy intimate activity should complement a well-rounded life that includes social connections, physical activity, hobbies, and other stress management techniques. If you find yourself using intimate activity to avoid social situations or emotional processing, this may indicate a need for professional counseling support. Hormonal disruption concerns. While moderate activity supports healthy hormone levels, excessive frequency, multiple times daily over extended periods, can potentially disrupt the natural hormonal rhythm. Using intimate self-activity as a replacement for partner intimacy can strain relationships. This is particularly important for men in long-term marriages or partnerships where intimate connection is valued by both partners. If self-activity is interfering with partnered intimacy, or if you're avoiding partner intimacy in favor of solo activity, this may indicate underlying relationship issues that could benefit from couples counseling. Medical condition masking. Sometimes, changes in intimate function can be early indicators of serious medical conditions. Erectile dysfunction, for example, can be an early warning sign of cardiovascular disease, diabetes, or hormonal imbalances. If you can only achieve normal function during solo activity but not with a partner, this could indicate underlying medical issues that need professional evaluation. Don't use solo activity to avoid addressing potentially serious health problems. Some research suggests that very frequent ejaculation might temporarily reduce testosterone levels, though they typically return to baseline within 24 to 48 hours. For men already dealing with low testosterone, this temporary reduction might be noticeable. The medical recommendation is moderation and attention to your body's natural rhythms. If you notice persistent fatigue, decreased motivation, or other symptoms of low testosterone, consider reducing frequency and consulting with an endocrinologist. Fertility and reproductive health impact. While not relevant for all men over 50, those who are still interested in fathering children should understand that daily ejaculation can reduce sperm concentration and potentially impact fertility. For optimal sperm quality, medical guidelines recommend an abstinence period of 2 to 5 days between ejaculations. This allows for full sperm maturation and optimal concentration. Many medications commonly prescribed to men over 50 can affect intimate function. These include blood pressure medications, particularly beta blockers and diuretics, can affect erectile function and ejaculation. Antidepressants, especially SSRIs, can significantly impact libido and ability to achieve climax. Prostate medications like finasteride can affect ejaculate volume and sexual function. If you're taking any medications and notice changes in intimate function, don't simply work around these changes. Discuss them with your prescribing physician. Often, alternative medications or dosage adjustments can improve function while maintaining therapeutic benefits. Understanding normal age-related changes can help you maintain realistic expectations and identify when something requires medical attention. Normal changes include decreased sensitivity, longer time to achieve arousal, decreased force of ejaculation, longer recovery periods between activities, and decreased overall frequency of spontaneous arousal. Concerning changes that warrant medical evaluation include complete inability to achieve function, pain during activity, significant changes in ejaculate appearance, or any lumps, bumps, or changes in genital anatomy. Men with diabetes, heart disease, or other chronic conditions need special considerations. Diabetes can affect nerve function and blood flow, potentially impacting intimate health. Cardiovascular disease may limit the intensity of activity that's safe. Work with your healthcare team to understand how your specific conditions affect intimate health and what modifications might be necessary for safety. Current research in male aging and intimate health is expanding rapidly. We're learning more about the connections between intimate health and overall longevity, cognitive function, and disease prevention. Emerging research areas include the role of intimate health in maintaining telomere length, which affects cellular aging, its impact on neuroplasticity and brain health, and its potential protective effects against various age-related diseases. As our understanding deepens, recommendations may evolve. This is why maintaining regular communication with healthcare providers and staying informed about current research is so important. For you, my strongest recommendation is to have honest conversations with your healthcare providers about intimate health. Most physicians are well trained in these areas and can provide personalized guidance based on your specific situation. Remember, aging doesn't mean the end of intimate health. With proper medical guidance, attention to safety, and evidence-based practices, intimate health can remain a positive part of your overall wellness strategy well into your later years. Take care of your health, stay informed, and don't hesitate to seek professional guidance when you need it.